Welcome everyone. Today we'll discuss the diagnostic criteria for migraine based on ICHD3 guidelines. These criteria help us to differentiate migraine from other headache disorders, and it helps us to make an accurate clinical diagnosis. So now what we are learning is based on ICHD3 guidelines. It will tell us how exactly when a patient presents with headache, how do we label him as he's a patient of migraine. So migraine is a common neurological disorder with a recurrent headache attacks. It is not just like any headache. Remember, it comes with a specific pattern. And remember, we don't have any blood test or a scan to confirm that it is migraine. So it is mainly we rely only completely on clinical criteria. Now remember, when we make an accurate diagnosis, it will also help us in managing these patients appropriately. So it's very important to diagnose migraine carefully. So before we look into the types of migraine, we actually have two types, migraine without aura and migraine with aura. So let us understand first what is aura, then we'll go into the diagnostic criteria. An aura is a warning sign that usually comes before or during a headache. Remember, it comes even before the headache sets in or during the headache. It can be visual symptoms, sometimes like a flashing of light, or sometimes patient can suddenly he can feel that he is seeing a blind spot, or any other sensory symptoms also like tingling, numbness, or difficulty speaking. These are some of the symptoms which we call it as aura. Okay, and remember, it takes around it builds gradually, starts over 5 minutes, may continue up to 20 minutes to 1 hour. These aura symptoms may persist. So what are the aura symptoms we are talking about here? It may be a visual symptoms or a sensory symptoms or sometimes auditory symptoms as well, and they are fully reversible. Remember, these symptoms, the associated symptoms are fully reversible, and that will vary from person to person. We can tell it is unique to each person. I hope you guys are clear. Aura is a warning sign that comes before or during a migraine attack. Now we'll see how to diagnose this migraine without aura. First of all, remember, this is the most common type of migraine. Not everybody gets aura. To be diagnosed, you need at least 5 attacks. So for example, now before the patient comes to you, he should have at least minimum of 5 attacks, and each attack should last for about 4 to 72 hours. So minimum 4 hours of headache if a patient complains, 4 hours to 72 hours. You can imagine it almost runs to about 3 days. And the pain, no, at least the to understand the characteristic of pain, we have the C criteria where at least two of the following should be present. One is migraine headaches are usually unilateral headache, and they'll be pulsating or a throbbing kind of pain. That's a quality of the pain is pulsating type, and it is not a mild variety. The pain has to be like moderate to severe variety. Okay, and it is aggravated by regular physical activity, just like walking or climbing stairs. No, that itself will aggravate the pain. And sometimes associated symptoms, so usually at least one of the associated symptoms should be present, like nausea or vomiting, and photophobia and phonophobia. Photophobia meaning sensitive to light and sensitive to sound, like they don't want to hear any loud noises, they don't want to see lights. So this is the associated symptoms what is present with migraine. Clear? And no other ICHD3 diagnosis, meaning you have to exclude all the other causes of headache. Clear? Just to summarize again, remember, when a patient comes to you, at least he should have had 5 attacks fulfilling the following criteria. And individually, if you see one headache episode, it should last for a minimum of 4 hours up to 72 hours. Remember, it is like in untreated or unsuccessfully treated cases, this is what happens. Because if they start taking some painkillers and all, the pain will reduce, right? So in untreated cases, each episode will last for about 4 hours to 72 hours, and at least two of the symptoms of this pain should be present, this headache type. No, it will be a unilateral type, pulsating variety, and the severity is like moderate to severe, and it is aggravated by just routine activity like walking. And the associated symptoms, at least one of them should be present. Okay, either nausea or vomiting, or photophobia and phonophobia, and rule out other causes. This is how you diagnose migraine without aura. Next, we'll move on to migraine with aura. Okay, for this diagnosis, at least 2 attacks is enough. Okay, and it is a reversible aura, meaning the symptoms of aura, whatever I mentioned previously, like visual, sensory, or auditory symptoms, all these are reversible. and at least three of the following should be present. Okay, that is, the aura symptoms builds slowly over 5 minutes. It is not like suddenly they come with the aura symptoms. Like aura symptoms, slowly it will start, and patient knows like, okay, he's about to get his episode of migraine now. Two or more symptoms occurs in a row, sometimes like one after another, no, sometimes the visual symptoms, then followed by sensory symptoms, like that. Again, remember, it is and these symptoms are usually unilateral, or sometimes more than one positive symptoms like flashing of light, or the visual symptoms he can start seeing. And aura is followed by headache within about 1 hour. It usually the headache starts. Okay, that is when we call it as migraine with aura. Now, understand the difference here. There are two types of migraine: migraine with aura, migraine without aura. When I tell migraine with aura, the patient can have just two attacks and he can come to you, and you can still call it as migraine if he has aura symptoms. If a patient doesn't have aura symptoms, at least minimum 5 attacks he should have had to call it as a migraine with all the associated symptoms what I told. Now, one confusion is like sometimes patient will be like a like from long time he gives this history, then we can name him as like a chronic migraine patient. That is, chronic migraine is diagnosed when you actually have when a patient has headaches on 15 or more days in a month, and he gives this history for about 3 months. Like, from past 3 months he has headache, and remember, in a month, almost like half the month, almost more than 15 days he has headache, and history of more than 5 attacks meeting migraine criteria, what I told initially, like unilateral pain, pulsating type of pain, and associated symptoms, all this if they are present, then it is again, we call it as migraine. And remember, on more than 8 days per month, features are typical of migraine. Yeah, this is when you call it as patient is suffering from chronic migraine. Sometimes you want to differentiate, like not all headaches are migraines. Okay, remember that. Now these days, like everybody is stressed, right? So we keep getting tension type headache. How do I differentiate from a migraine? Is tension type headache is bilateral, and it is a mild severity. Remember, I told you previously, if a patient has a moderate to severe headache, we call it as migraine. Now it is a mild variety and it's a non-pulsating quality of pain, then we call it as a tension type headache. Sometimes patient will have what is called cluster headache. That means he's like super intense, severe one-sided pain, usually around the eye, and it comes in clusters, like on and off it comes. Okay, that is called as cluster headache. To rule out sometimes, no, remember, the presentation might be like an headache symptoms, but it might be secondary to some other underlying causes. So always it is very important to maintain a headache diary. Whenever a patient comes, you ask him to note down, like, what is the quality of pain? Is it unilateral or is it bilateral? Does it have that nausea or vomiting, photophobia, phonophobia, these symptoms? Does it worsen with walking? Get all this history. Okay, and you also ask him to like maintain the duration of headache, how long it lasts, clear, and does he have any aura symptoms? So all this he can note down, and that we can call it as headache diary. Also remember, you need to have what is called as snoop red flags, otherwise called a snoop checklist. Okay, this is for us to diagnose, clear. Okay, S stands for systemic symptoms. For example, along with headache, does patient have fever or weight loss? N stands for neurological symptoms, like does patient have confusion when he is having headache, or does he have any weakness? Okay, and then O stands for like onset that's sudden, like suddenly, we call it as a thunderclap headache. Suddenly the patient gets headache. O again is another one, is old age. Just see the age of the patient. Okay, onset if it's after 50 or something like that, and suddenly the pattern change. Your usual headache suddenly it starts getting worse. That is called a like change in any pattern of the present headache or whatever he was having previously. So if you have any of these, no, it's better to investigate further instead of just naming it as migraine. So I'll repeat again. Yes, is like some systemic symptoms, like weight loss or fever or something. Neurological symptoms like confusion, then weakness, sudden onset and old age, and any change in the pattern. So these are all red flags which need further investigations. Okay, another one is ID migraine tool is also can be used. That is nothing but like, see, this history taking takes a lot of time, right? So what they've done is using this ID migraine tool for a screening the patients. They just ask some minimum some three questions. One is, have you felt nauseous with your headache? Like whenever you get a headache, do you feel nauseous, or are you sensitive to light? This is the second question. Third is, have your headache limited your ability to function? Does it like reduce your work? Clear? So this is your ID migraine tool. Okay, just some are some basic questions which will help us in coming to the diagnosis of migraine. So hope you guys understood the basics of migraine here. Just to summarize, no, what I was trying to tell you is you have two types of migraine. One is migraine without aura and migraine with aura. If a patient is as to be diagnosed as migraine without aura, meaning he should have had at least 5 attacks, each attack lasting for 4 to 72 hours, and has the classical features of migraine like unilateral throbbing type of pain. Severity is like severe to moderate to severe. And migraine with aura meaning two attacks is enough to diagnose them as migraine with aura, along with a reversible visual or sensory changes like the aura symptom should be present. Chronic migraine meaning 15 plus days per month he has migraine like symptoms. Okay, and always remember, don't forget to have this Snoop checklist. Okay, because we cannot just name him as suffering from a patient has migraine and you leave out all red flags. Clear? Because further screening is needed in some patients. So that's why you can use the Snoop checklist for that. So now thank you for staying for this long. If you found this video helpful, give it a thumbs up and also subscribe for more clear and concise medical content. If you got any questions, you can always drop it in the comments section below, and please share it to your friends if you find that it might be helpful for them also. Thank you.